Hello friends, how are you all? Very good afternoon to all of you. And I'm very sure that by this time Diwali का पूरा hangover खत्म हो गया होगा. You all must be free from all your festivals and now focusing totally on your examination. So we have to follow our dreams. We are not going to compromise at any point. Whatever will be the situation, we will try to that level that we will be able to achieve our dreams or achieve our goals. Okay, now repeatedly I'm getting the message from the students that, ma'am, everything is mess up in PSM. When we study one topic, we think that yes, it is very clear to all of us, or very clear to me. I'm able to understand each and everything. I'll be able to solve each and every question. But after a couple of days or after a week, again, it appears that everything is new. Now, this is a human tendency. This is not happening with a single student. Mind my words, it is happening with all of you. If I would have been at your place, the same situation will be with me also. And on the top, that this is not only for the one subject, it is for each and every subject. And that's why this is giving us a panic state. इतना पढ़ रहे हैं, इतनी मेहनत कर रहे हैं, साला कुछ भी याद नहीं रह रहा है, क्या करें? Now we are reading so much, we are doing hard work so much, but in spite of that, we are not able to remember what will happen in the examination. This is the phobia which is getting piled up day by day. So don't worry. I know that you are working hard. Your everything is getting registered in your gray matter. So after completing the national program, what I had decided to discuss the previous year questions, and the purpose of discussing the previous year question was this only, that I want to remove the phobia from the brain, from the heart, from the mind of each and every one. When you will see the questions, and definitely you will be able to answer the question. When you see the question, read, see the choices, automatically you remember the points, you remember the things, remember the concept, and you very well answer. And in the end, you will say, oh, ये तो कितना simple subject है, कितने simple questions पूछे जाते हैं, and I am able to answer all those questions. Okay, so with these words, we are coming to the last session of our this subject, that is preventive and social medicine. The rest all we had discussed. Now we are left with national programs. Now, as I said that national programs, almost around major programs, 80-90% has been covered, that are mainly asked in detail in the examination, where we had discussed the programs in related to the various infectious diseases in relation to the nutrition, the vaccination, and demography. Wherever we had a big programs, we had already discussed. Now we are left with a few national programs, and here what we are supposed to know, we are supposed to identify the logo of that national program, because sometimes they give you the logo of a midday meal, they give you the logo of the ICDS centers, they give you the logo of Pradhan Mantri Surakshit Matritva Abhiyan. So we have to identify the logo of a few national programs only. We have to remember the one or two points about that. So now we will be starting our topic of discussion, and that is national programs. Now, initially, few around 15 to 20 national programs only, we have to just write their names again, just to complete the list of the national programs at one place, although we had discussed them in detail in the respective topics. So first program what we had already discussed was, so now we are discussing the national program, so we will make a list. The first program is the National Tuberculosis Elimination Program. National Tuberculosis Elimination Program. We had written each and everything about that, and I had put both the logos simultaneously, because this logo number A, it was the National Tuberculosis Control Program logo, what was earlier, but now it has been shifted to the National Tuberculosis Elimination Program, and this is the new logo, that is TB Mukt Bharat, TB Harega, Desh Jeetega. So this is one program, National Tuberculosis Elimination Program. So just a revision that we had discussed, that the infrastructure is designated microscopic center, tuberculosis unit. We should be able to remember the population, what are their functions. Then the most important test of investigations in this, we are doing then sputum along with the X-ray test. So if they ask the single, then it is a sputum, but they ask which is the most important test now we are doing is the CBNAT, because CBNAT is more confirmatory, because it is giving us a rifampicin resistance also, and rifampicin is a very, very important drug for treatment of tuberculosis. Then we should be knowing the various categories, and category 1, 2, not the 3, 4, and 5. What are the basic drugs for the category 1? It is the 4 drugs we are giving. The 2 plus 6 months is the duration, and we are doing the follow-up. Now, in the multi-drug resistant and the ASDR cases, we didn't discuss the drug names in detail because you had already studied in your pharmacology classes. So, because here we have to check for the drug sensitivity, and we are checking, or we are giving the medicine as per the guidelines. Then we should be knowing about the pregnancy with HIV, the pregnancy with the pregnancy, or the tuberculosis with HIV, tuberculosis with the pregnancy, how we are going to detect the latent tuberculosis, what is the Montague's test or the tuberculin test, what is about the BCG vaccination, our goal and national programs. So this all we had discussed. Now the second program is the relation to the leprosy, that is National Leprosy Eradication Program. Again, we had discussed everything about this program, and this is the logo. So I'm writing in short, we had already written National Leprosy Eradication Program, and here we should be knowing that based on the number of these conditions, we are classifying in a posse and multibacillary, their treatment, their duration, their follow-up, and we should be knowing that what are the infrastructures, that is set centers, urban leprosy centers, the leprosy care units, then what are the indicators of the program, then how we are trying to do the elimination, what is the elimination criteria, all we had already covered. Now the another program is that is related to the AIDS, that is a National AIDS Control Program. So third program is a National AIDS Control Program, and we had seen another a branch of this National AIDS Control Program is the PPT-CT, prevention from parents to child transmission, and this was the logo of the Suraksha clinics, where we are giving the 7 color kits, and we should be knowing the sentinel surveillance, then what are the drugs we are giving as in fixed dose combination therapy, when to start the therapy, what are the various opportunistic infections in cases of HIV, at what CD4 count level we can have this opportunistic infection, what is a highly sensitive test, what is a highly specific test, what are the goals, everything, and how we are preventing from the mother to child transmission. This all we had discussed. Another program we had in relation to the polio, that is the National Polio Elimination Program. National Polio Elimination Program, and we had discussed the very important is the pulse polio and acute flaccid paralysis, and this is another image. This is just to inform you, not ask in the examination, like after the elections, or the when you are going to cast your vote, the ink has been applied on the index finger, and the purpose is that you are not going to give the fake vote second time. Then same like here we are applying a ink on the little finger, and this is just to know the baby had received the vaccination or not. This is not for the fake vaccination, this is just to confirm where we have received or not. Otherwise what happens, the parents will say that no हमने तो अपने बच्चे को पिला दिया, but the ink is not there. It means the health worker will be coming to know that mother or father are telling lie. So this is your pulse polio elimination program and everything about the AFP surveillance. Then another very important program in relation to the vector-borne infections is the National Vector-Borne Control Program. National Vector-Borne Disease Control Program. National Vector-Borne Disease Control Program. So this is another very important national program, and we'd already seen that yellow fever is not included in this program, and what are the guidelines of malaria under this. that what are the drugs we are giving for the treatment in the northeastern states, other states for the Vivax falciparum during the pregnancy also. And we should be knowing the guidelines of elimination of filariasis also, the leishmaniasis, then dengue management, chikungunya management, and chikungunya is again a viral infection, so only the supportive treatment we have to give, and Japanese encephalitis. So these are the various diseases included under the National Vector-Borne Disease Control Program. Now another very important national program is the National Health Mission. We had already covered that the rural mission, urban mission, the ASHA and the USHA workers, and at the level of PSC, all the activities are being conducted under the National Health Mission. Clear? Then we are having another program as the relation to family planning, and that is National Family Welfare Program. National Family Welfare Program, and we are discussing in detail in contraception all the guidelines, that how we are going to give the contraceptives, what should be the age eligible couple, which contraceptives are Chaya, Antara, we are giving the OCPs, we are having a Nishchay kit, we are having a PPICD insertions, and all this we had discussed already in our topic of contraception. Then another national program we are having is the intensified Iron Plus initiative. Intensified Iron Plus initiative, or this was also called as the Anemia Mukt Bharat. Anemia Mukt Bharat, or Intensified Iron Plus initiative. We should be knowing the various beneficiaries, then how much of iron, calcium, and folic acid we are giving, what is the frequency. Then we discuss another program in relation to the immunization, that is the Mission Indradhanush. And here we were already discussed that are 7 diseases as per the earlier program. Then we had added 7 more disease. So what are the vision, what are the goals, which diseases are included, and how we are doing the surveillance, that is by cluster random sampling, everything we had discussed. Now we had discussed another program, it is related to immunization, was the Universal Immunization Program. Universal Immunization Program, here we were giving the various vaccination as per the age. Then related to the Indradhanush, it is not a mission Indradhanush, but it was a Abhiyan Indradhanush. Abhiyan Indradhanush, it was related to the occupational health, it was related to occupational health, and as we had discussed, it was nothing but the daily change of bed sheets. It was related to the occupational health, and that was a daily change of the bed sheets as per the color of a web gear. So this was the Abhiyan Indradhanush. Okay, so no confusion in Abhiyan Indradhanush and Mission Indradhanush. Mission was related to vaccination, and Abhiyan was related to the change of a bed sheet in the hospitals. Now then we had the another program, and this was an IDSP project. And if you can remember, we had discussed while discussing the functions of multi-purpose worker BL in healthcare system, that they had to fill a various form, the S form at the sub center, the P form at the primary health center, and the L form in the community health center, and they are sending the information. And if there is any disease is reported in a previous week, then immediately the management team will come from a higher center, will try to control. So IDSP project is an integrated disease surveillance project we had already covered. So I'm just moving because I'm not writing anything, everything we had written and where we had written this I am telling you. So you will be having a not a problem, or you will be at ease in finding where these programs are. Now another is related to midday meal. And here the very commonly asked question is the composition of the food. We should be knowing how much calories, how much protein is being given in the primary school and the middle school, sorry. Primary school, middle school, which is the ministry controlling, and who is carrying out all these activities. It is the Anganwadi worker. Then we are having the another program related to the ICDS centers, and it is the logo. So this is the logo of the ICDS centers, Integrated Child Development Services Center, and here the beneficiaries are the children, mother, and their bodyguards. But we had already discussed and their functions, and the main worker is the Anganwadi worker. Now, another program is related to iodine deficiency. We discussed the iodine patch, and this is the National Iodine Deficiency Disease Control Program. National Iodine Deficiency Disease Control Program we had already covered in nutrition. Then another program we had in relation to the blindness, and that is a national program for prevention and control of blindness and visual impairment. National program for prevention and control of blindness and visual impairment. This we had discussed in the last class while discussing the blindness in non-communicable diseases. So these were the few important national programs what we had already covered. Now I'll be discussing the few more program. This is a program, and this is now you can start writing because these we had not discussed earlier. And this is your India Newborn Action Plan. This was started in year 2014, India Newborn Action Plan. And how we'll remember the logo? That here the baby is sitting nicely inside the womb. And the purpose is that once the baby delivers, we should give all our preventive measures to avoid the mortality. So we have to bring down the single digit neonatal mortality, single digit neonatal mortality and stillbirth rate by 2030. So remember this point that we have to bring down the single digit neonatal mortality and the stillbirth rate. Right now it is in the double digit. So by 2030, this was the question asked that we have to bring down the neonatal mortality and stillbirth rate. Now another program is, it is in relation to elderly people. You could see the elderly people are there and we have to protect them by giving the services. So next number will be your 17. So next program is National Program for Care of Elderly People. So this is your program number 7, that is National Program for Health Care of Elderly. National Program for Health Care of Elderly. And this is just to provide a separate, specialized, only we have to remember the logo and one point about that. So this program provides, obviously it is a program for the elderly people, so we'll be providing the services to the elderly people. So this is to provide the separate, specialized and the comprehensive. It provides the separate, specialized and the comprehensive health care to senior citizen at the various levels of the healthcare. So this is a national program for healthcare of elderly. Nowadays, we are having a program which is actually the clubbing of the various programs. Earlier, we had a program separately for cancer, for cardiovascular diseases, for diabetes, hypertension. Now we had combined a program And this is what is the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases. But a point to remember here is the slogan is that health is in your hand. So these are the flowers which are depicting the health, and they are trying to, individual person is trying to catch their own health. And we know that our health is in our hands. And if we are taking a good quality food, if you are doing a regular exercises, if you are not having the addiction to the smoking, alcoholism, then definitely we can keep ourselves fit and fine. So the next program is the national program for control of national program for control of diabetes, national program for control of actually this was a actual sequence, the national program for control of cancer, diabetes, cardiovascular diseases and stroke. National program for control of cancer, diabetes, cardiovascular disease and stroke. And the guidelines of this program is now that earlier we used to say that we are doing a screening of individual for sugar and blood pressure after 40 years, but now they say that disease can start at an earlier age group. So the guideline is that we have to screen of individual for blood pressure and sugar at an age of 30 years and above also. So we are doing a screening for blood pressure and the sugar beyond 30 years also, as well as we are doing the pregnant woman at sub-center. Each and every pregnant woman, a pregnant woman may be a 20-year or 22-year-old lady, still we are doing to diagnose the blood pressure and the sugar during the pregnancy and avoid the complications. So this is only the one point what we have to remember about the program, that screening of the blood pressure and the sugar in more than 30 years and the pregnant woman at a sub-center. Then we had another program that is related to the mental health. That is National Mental Health Program. National Mental Health Program. This was in the 2014. And here we have to provide all type of mental care. We have to provide the all type of the mental care to our community, and we are having the mental clinics from district hospital onwards. So from the district hospital onwards, we are having a special clinics, mental clinics, and where the person is going and getting treatment for all the type of mental problems. This is National Mental Health Program. Then another program which is taking care of health of individuals as a family, and this was asked in the last exam also, and that is the Pradhan Mantri Jai Arogya Yojana, PMJ, or Ayushman Bharat. PMJ or Ayushman Bharat, and this is also known as Ayushman Bharat National Health Protection Scheme. Ayushman Bharat National Health Protection Scheme. So basically, the point to remember is that here we are giving the coverage of around 5 lakh rupees per family per year. So here we are giving the coverage of the 5 lakh rupees per family per year. This was the question asked in the last exam, that under the Ayushman Bharat or the PM जय योजना, प्रधानमंत्री जन आरोग्य योजना, or Ayushman Bharat National Health Protection Scheme, we are giving the 5 lakh rupees per family per year. And the purpose was, when this program was started in year 2018, our purpose was that to cover at least the 10 crore families. So presuming that 5 members in a family, so at least the 50 crore population should be covered. Okay. Now another we are having to give the employment to the individuals, that is Manrega, Mahatma Gandhi National Rural Mahatma Gandhi National Rural Employment Guaranteed Act. Mahatma Gandhi National Rural Employment Guaranteed Act. This was passed in year 2005. Actually, the problem of each country is that citizen, they blame ruling party that they are not giving the opportunities for employment. काम नहीं दे रहे हैं, सब खाली बैठे हैं. So what the government has decided, as you could see the logo of this program also, that at least each member of the family should be given some non-skilled work. So for that they had to register to their nearest Gram Sabha, and within the registration of the 15 days they are getting the job for minimum 100 days. And this job is unskilled job. You cannot expect that always a babu wala job ki kursi pe office gaye, kursi pe baithe aur kaam karke chale aaye. No. If any physical work is going on, some road is being constructed, some government building is constructed, still they have to work there. So only the point to remember is that Mahatma Gandhi National Rural Employment Guaranteed Act this was to give employment to a member of the family they have to give the employment to at least a member of the family for minimum 100 days. So when this program was started, it was given for 100 days. That's why you can see the logo also. But now currently, please make a note here is, but currently they are giving the job till 150 days. So see the question carefully, whether they're asking when this program was started. It was for 100 days, but currently they are giving for the 150 days. And again put a note here is that they are planning to increase it up to 200 rupees per month. Sorry, not a per month, it is per day. Sorry. 200 rupees nahi hai, I'm extremely sorry. Now they are planning to increase it up to the 200 days. Clear? So when this program was started, they decided to give the employment for the 100 days, but currently we are giving for the 150 days, but the government is still planning to increase it up to the 200 days. Clear? So this is about your Manrega. Then we had a program related to the deafness, and this is your national program for prevention and control of deafness. So you could see that there is an ear and some deafnesses there related to the ear. So another program is National Program for Prevention and Control of Deafness. Now here we are dealing their screening, giving them services, treatment to prevent and control the deafness. Now just remember the one point that you might have seen in the families, your grandparents might be having some little bit difficulty in the hearing. And many times when they say, beta jara जोर से बोलना मुझे सुनाई नहीं दे रहा, So you shout on them, बाबा इतनी जोर से तो बोल रहा हूँ, बहरे हो गए क्या, सुनाई नहीं दे रहा. What it means that whenever your grandparents they tell you, dear, please speak loudly, I'm not able to hear, then you get irritated and you say, Baba or Grandpa, I'm talking so loudly, you had some problem, you are not able to hear me. So that is not their fault, it is because of the aging process we are having the hearing loss. So that duration for which they are not hearing and they have to live with that, it is again a dali. So this is another question, is that deafness is supposed to be the second cause of the a dali or the ear lived with disability. Okay, so what is the first cause currently? The first cause is the depression and the second cause is the deafness. Clear? So deafness is the second common cause of a DALI or the ears lived with a disability in the community, and the first cause is the depression. So this is about the National Program for Prevention and Control of Deafness. Then we had another program, and we all know that during the demonetization, the lots of money was deposited under this account. So this is your program number 23, and this is Pradhan Mantri Jan Dhan Yojana. Pradhan Mantri Jan Dhan Yojana. Now, this program was started in the year 2014 when this BJP government came in first tenure. And the points was about this program is that we have to open a zero balance account. They said that every person should have the bank account whether they are not having the money or not. So zero balance account. There was a release of a Rupee debit card, because debit card is supposed to be a symbol of status, and they say that if a person is using the card, it means must be having a good amount of the money. But they had issued this Rupee debit card against this PM Jan Dhan Yojana scheme or the accounts, and that card was used as a debit card. And another point was that it was for direct transfer of the a subsidy. So it was promoting to open the accounts so account can be linked with their Aadhaar card and other services. So directly the money can be transferred to their account. So there is direct money transfer. So no in between or intermediate agent can take your money. Like currently we are having the use of this account for transferring the subsidy for the LPG cylinders. Now, earlier they were giving the discounted rate cylinders at a rate of 500, 400, 500 at that time. But on black, the cylinder was roughly around 1000 rupees. So there was a shortage being created by these agents, and the public has to purchase for the 1000 rupees or even more. But now what the government says, that first you have to purchase. It's like a Paytm cashback. You have to pay the full amount and then a cashback is coming in your account. Same like this, that now for the LPG cylinder, the community has to pay the full amount and the subsidized amount is coming back in their account. So no in between or intermediate agent can take your money. So this was the purpose, the direct money transfer, and this was also acting as a micro insurance. It was also acting as a micro insurance, means whenever there is a death of a person, the 1 lakh rupees will be given to the survivor. So these were the purpose of PM Jan Dhan Yojana, and this is a logo of that program. Okay. Then we had another program, although that was not a very successful, that is Swachh Bharat mission. Swachh Bharat mission. This was also started in the 2014, and our purpose was that by the 2019 that we should make India free from open field defecation, as well as will have a scientific disposal of all the domestic waste. But although this was not very successful, but if I want to give my personal opinion, that it was not only the responsibility of the government, but it is the responsibility of each and every citizen of India, that we should try to keep our nation clean. Then only this program will be successful. But for the exam purpose, because this is again a debatable point, but for the exam purpose, the point to remember here is that the purpose was that there must be the 100% scientific disposal of domestic waste. There must be the 100% scientific disposal of the domestic waste, and there must be the complete stoppage of open field defecation. So there must be the 100% scientific disposal of the domestic waste and the complete stoppage of the open field defecation in rural and urban areas. In the rural and urban slum areas. So complete stoppage of the open field defecation in the rural and urban slum areas. So this is about your Swachh Bharat mission. Clear? Then another program was the Dakshta program. It must be the number 25. Okay. Dakshta. Daksh कहते हैं skill. So if we want to improve the MCH care, if we want to reduce the mortalities in the labor room, that we have to give the training of the staff who is conducting the deliveries. So here the point is that for the good quality of the MCH care, for the good quality of the MCH care, there must be the proper training of health workers. So for the good quality of the MCH care, we should be having the proper training of the health workers, that is your Dakshta, or Daksh workers we will be getting at labor room. Because if a person who is conducting the delivery, she doesn't know how to resuscitate the baby, then we will be having a neonatal mortalities. If she doesn't know how to manage the PPH, then definitely we'll be having the high maternal mortalities. So time to time we are giving them a training. Now another program is Sabla. Sabla scheme. We all know the poor lady we call as a abla nari, कि abla nari थी भाई कुछ नहीं कर पाई. That lady was very poor, was not able to protect herself. So under this Sabla scheme, our purpose is that we have to do the woman empowerment. That this program is for the woman empowerment. Either we are giving them the good nutrition, good education, good jobs we are giving. Now there is no gender differences there. So we are giving them the vocational trainings, so they are able to earn money, they can be financially independent, they are quite educated, and they can take care of their future. So supply scheme is the woman empowerment. All the different activities are being conducted for women empowerment. Then we had another program, and we had written, I think, each and everything about this while discussing the prevention in obstetric. That is Pradhan Mantri Matratva Vandana Yojana. Only just write the name, Pradhan Mantri Matratva Vandana Yojana. And here we had already discussed that we are giving 5,000 rupees of cash incentive in three installment. The first we are giving on registration within the first trimester, then we are giving on the second after the 6 months when one antenatal visit is there, and the third we are giving after delivery at 6 weeks when hospital delivery, the baby had received the vaccination, the mother had received any contraceptive. So 1,000, 2,000, 2,000, like 5,000 rupees we are giving incentive. So just write the 5,000 rupees we are giving incentive, total 5,000 in installments. Then we had another program, this is again we had already covered, is Pradhan Mantri Surakshit Matratva Ashwasan, sorry, अभियान है. Pradhan Mantri Surakshit Matratva Abhiyan. And as you all know that here in the 9th of every month, the free antenatal care is being given by private practitioners. Okay, and we have discussed the various type of the stickers in that. So Pradhan Mantri Surakshit Matratva Abhiyan. Then we had another program. This is again a part of women empowerment only. That is Beti Bachao, Beti Padhao. Beti Bachao, Beti Padhao. It means that save the girl child and educate the girl child. Because the now girl child should not be considered as a burden to the society, to the family. So we have to save the girl child, avoiding or preventing the antenatal sex determination and the feticide, female feticide, and we have to educate the girl child so they should be self-dependent. So Beti Bachao, Beti Padhao. Clear? As we all know that medicines are quite expensive, so many of the community people, they are not able to afford the medicine from the market. So we are having the same generic brand of the medicines available at a very cheaper cost through the Jan Aushadhalayas. So we are having the PM Jan Aushadhi we had a PM Jan Aushadhi Pariyojana. As I always say that all these national programs name are by the Hindi name. That's our official language. So it's a Pradhan Mantri Jan Aushadhi Pariyojana, or we can say the Jan Aushadhi. Aushadhi कहते हैं medicine को. It is a scheme. So here the concept is that generic medicine availability at affordable cost. Generic medicine availability at affordable cost. This is Pradhan Mantri Jan Aushadhi Pariyojana. Then we had another program. This again we had already covered. It is Arman. That is advanced reduction in the mortality and morbidity in mother and neonate. Advanced reduction in the mortality and morbidity in the mother and the neonate. So we are doing all our services, MCS services, good care, good training. So ultimately there should be the reduction in the mortality and the morbidity. So this is all the combo of the various MCH activities what we are providing to the mother and the baby. So this is Aman. As I said that every time the new government comes and they start a new scheme with a new name, and the basic just is the same, that they had to give the services, but their own name and fame, they are starting that new scheme. And we have to remember the name, that Arman is related to the MCH care. Now another is, we had again already discussed as the Kilkari app. So this was 31, and this was a Kilkari app, and this is nothing but it is a mobile application. So Kilkari app. किलकारी होता है कि बेबी का साउंड. So if we are giving the good care to the mother and the baby, the mother will be able to hear the sound of the baby, the good healthy baby will be delivered. And for this we are giving the audio messages during the pregnancy. We had already written this. So this is Kilkari. Now another is that in addition to giving the training to the workers, we should have the good facilities also. So another is Laksh. And here the Q is usually mentioned with a different letter, different color, Laksh. And here the Q is representing the quality. So this is Laksh, and the purpose is that we should have a good quality services. We should have the good quality services in the labor room. So this is for the improvement of the labor room quality. So Lakshya is the good quality services is available in the labor room, or improvement of the labor room quality, so we can provide the good services. So Q is the quality. Then we had another program. This is again we had discussed. It is Suman. I think previous one was 33. This is 34. Is Suman. And this is Surakshit Matritva Ashwasan. Don't consider the or confuse with the PM Surakshit Matritva Abhiyan. That was free antenatal care on the 9th of every month, and this is Surakshit Matritva Ashwasan. Ashwasan होता है assurance. So whenever a mother is becoming pregnant, they want to get an assurance from the government that during the pregnancy or after the delivery, that she and her baby should be healthy. So we have to give them the assurance that yes, we are giving you the food quality and nothing will happen to you or your baby. So this is your Surakshit Matritva Ashwasan. Then, as we all know that in the government sector, we are getting only the fixed salary. So government employees, they don't do much of the work. कि भाई ज़्यादा काम करेंगे भी तो क्या मिलेगा, कुछ नहीं मिलना. But in the private sector, you are getting the incentives as per the work you are doing. So the government has also started to give the incentive for the cleanliness and other services to the government sectors also. So they say that based on the services in the past 1 year, the ranking is made and they are being given the cash incentive. And this is Kaya Kalp. Kaya Kalp. And Kaya Kalp is nothing that here we are giving the cash incentive, and for this it is mainly focused on promoting the cleanliness in the public areas. So this is mainly focusing for cleanliness in public areas, and we are giving the cash award to public health facilities will give the cash award to the public health facilities that will demonstrate high level of cleanliness. So we are giving the cash award to the public health facilities that demonstrate the high level of cleanliness, hygiene, and infection control. So the most important line what we have to remember is that is the cash award to the public health facilities on a cleanliness. So cash award to the public health facilities on cleanliness. So this is just for their promotion. So this was about your Kaya Kalp, and this is the logo of Kaya Kalp. Okay. Then we had another program. This is a very rarely asked question and asked in the last December exam. That is an urban heart. Urban heart means either we have the assessment of the healthcare facilities in the urban areas, and there must be the equal distribution. Means we should be not differentiating the services to the individuals living in the urban areas that could be living in a slum areas or in the posh areas. So the government is getting the different informations and they're making the strategies. So there should not be any inequality between the services. That was an urban art. So only just remember the point about this, that is the question was asked is what is urban heart. This was the question asked, that what is an urban heart, and they asked the full form of this heart. So this is health equity assessment response tool. Urban health equity assessment response tool. We have to assess the equity or equality distribution and we have to plan accordingly. This is the main purpose of this program. So decision support tool, it is a decision support tool to identify and reduce the health inequities in the cities. So it is a decision support tool to identify and reduce the health inequities in cities, in urban areas. and this enables the local community it enables the local community program manager and the municipal national authorities. So this enables the local community program manager and the municipal national authorities to better understand the problem and manage it. So if you have to remember in a one line, you can remember that Urban Heart is an health equity assessment response tool, and this is to identify and reduce the health inequities in the cities. So these are the various important health related national programs. Otherwise, many new programs are being launched time to time, and as I said, that the new government comes and they launch their own programs, but these are the few important health related programs. So in this way, we had completed our syllabus of community medicine, and in the last, if I say that some of you are in the different steps. Now you all had crossed this phase. This was when you were in the foreign universities or thing, भाई मेरे नहीं होगा, मैं नहीं कर सकता FMG clear. This all had gone, but when you came back with this a thought कि भाई I want to clear my exam, मैं तो pass करना चाहता हूँ. And then you must have thought that how I could clear my exam, and that's why you had joined the mist. And then with the regular motivation, if you initially thought कि भाई I cannot do, then still you had decided कि भाई I should try to appear in the exam and I should try to crack this exam. And now some of you, or not some, I'll say that all of you had reached to this phase. Yes, I can do. Yes, I can do. And I am waiting for all of you in this stage in the end of the December, by 25th of the December, when you all are having your results, and then you will show me that yes ma'am, I had done it, मैंने कर दिया, मैंने पास कर लिया exam. So you are currently at this step, and or maximum of you are at this step, and I'm waiting for all of you to go to the higher step and say yes, I had done this. Okay, so now, as many of you are constantly messaging me that madam we are not able to remember anything, PSM याद ही नहीं हो रहा, and the problem is that we are able to understand. It's appearing to be quite simple. We are able to understand, but we are not able to remember. And for that, I thought let me discuss some of the questions asked in the previous exams. So when you see these questions, automatically you are recalling the concepts, and then you'll say yes, yes, I know the subject, I can do. So this will further boost up your confidence. Okay, so first we'll discuss the questions asked in the last June paper. And please, 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 these are the questions which we had framed based on the information received from your seniors. It may not be the same language what has been asked in the examination. Options may not be the same, but yes, the concept you can get कि भाई कौन से चैप्टर से क्वेश्चन पूछा था, क्या कॉन्सेप्ट था. So here what I'll suggest to you, that don't try to mug up the questions or their answers. Try to see that high topics, that from which topic the questions are being asked. And if you have to revise those topics again and again and you have to remember the things, so you may answer not only the single question, but you may answer all the 10-12 questions related to that high yield topic. Okay, so we have to focus on the high yield topics through these question papers. Clear? So now we'll be discussing the June 2021 FMG PSM section. Now, complications seen with the mumps. Pneumonia, it is not commonly seen with the mumps. Epididymoorchitis, yes, this is seen in the pubertal or the post-pubertal age group. Otitis media, it is again related to the measles, and the diarrhea, again it is related to measles. So here the correct answer is epididymoorchitis. We know that in children it is the pancreatitis commonly seen, and in the adults or the post pubertal age group, epididymoorchitis or the ophritis is seen, or we can have the encephalitis also. So here the correct answer is epididymoorchitis. Okay, so some of you are asking the tips, and I am giving you the tips here how to remember the questions, because we have to remember the high portions. Okay, now the next question is a 5-year-old child. Now please listen one thing. When an image is given, so see the image first, see the last line, see the options. Now in this image you could see a one baby with some swelling in the neck area. Now they are asking what the diagnosis is. So it is a measles, diphtheria, pertussis, influenza. Now here the measles is not looking like this. Measles may we find the rash. Diphtheria could be this. Pertussis, again there is a persistent cough. Again this is not there. And influenza, there is a running nose. So without reading the question, if I see the image, so I am coming with the answer as a diphtheria. But still I'll read the question. A 5-year-old child presented to a clinic with a complaint of fever, yes. Swelling in the neck, yes. Giving bull neck appearance, and this is very specific of the diphtheria, that is the bull neck appearance. So in this way you can save your time, and this time can be utilized for answering the lengthy questions. So the correct answer is diphtheria. Clear? Survey of the 4 cities A, B, C, D reported the total fertility rate as 2.1, 2.4, 2.6, 2.8. Now, which city has achieved the desired goal for TFR? Now, desired goal for TFR, obviously they had given a 4 cities A, B, C and D respectively their TFR. But in the options they didn't say and about the cities, and they simply asked that which city has achieved the desired goal for the TFR, and we know that a desired goal for the TFR is 2.1, because we want to reduce the TFR, that is a total fertility rate, to 2.1. So here the correct answer is 2.1. But if they are asking the cities, then definitely they should have mentioned the ABCD also. So there was a confusion. Some students were saying that they had mentioned the ABCD in the cities, and some they had mentioned only the number or the values of the TFR. Okay, whatever it is, that it means the TFR is important, its goal is important. And how you can achieve the 2.1% of the or 2.1 of the TFR, what should be the couple protection rate? So please message me, what should be the couple protection rate to achieve the TFR of 2.1. What is couple protection rate? How much should be the couple protection rate to achieve the TFR to 2.1? Okay, yes, yes, great, 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 excellent. So, to achieve the, just a minute, just give me a minute. So, to achieve the TFR to 2.1, our couple protection rate should be more than 60%, and this can be achieved, or we can go with the NRR of 1. So our couple protection rate should be more than 60% to have a TFR to 2.1, and then we can have an NRR to 1. So this is what we have to remember. The next is that orthotolidine test is used for detection of. Now we are discussing the environment that orthotolidine test we are using. It is detecting the free chlorine as well as the total chlorine, because for a short time it can detect the free chlorine. And the orthotolidine test, or the orthotolidine arsenide test, is best because it is able to detect the free and combined chlorine separately. Now this was again a question which we could not get the exact question from the students because there was a lot of confusion, and that's why I'm not very sure that how much I am able to present you in this question. That orthotolidine test is used for detection of chlorine demand. This is totally out because chlorine demand we are calculating by the Horrocks apparatus. Now free residual chlorine, yes, initially it is giving us a free residual chlorine, so this could be a possibility. Then combined chlorine, combined chlorine we can get also by this orthotolidine test because we are having the free and the total. So if we can minus the free from the total, we can get a combined. So this could be again the possibility, free and combined separately. Now free and combined separately, it is not possible because this is by the orthotolidine arsenide test. But if I have to choose a one between the free and the combined, then I'll go with the free chlorine, because free we can get and the combined we can get indirectly. So that's why I said that this was a little bit confusing question because I could not get the correct question or the correct options. Now the low stationary phase is which phase in the demography? And none other than is a phase of 4. So phase 1 is high stationary, the phase 2 is early expansion, the phase 3 is late expansion, phase 4 is the low stationary, and phase 5 is the reversal phase. Okay. Then maximum money under the PMJ Yojana. We had recently talked about that maximum money is a 5 lakh under the PMJ Yojana. Total number of the children born to a reproductive female is calculated by, again, the straightforward question. It is the TFR. So see, the fertility rates are very important. They had asked the two questions for this of total fertility rate. One is the definition, straightforward. Another they had asked about its score. So total number of the children born to a reproductive female is calculated by total fertility rate, T for total. General fertility rate is the total number of the children per 1000 mid-year population of the reproductive age group women, or total number of the live births, sorry. Now the gross reproduction rate is the total number of the girl children born to a woman in her entire reproductive phase, and the net reproduction is the total number of the girl children remaining alive till their own reproduction. So these are the various vital indicators. Clear? Then another is a health worker has two open vials, one each of the DPT and MR vaccine. So two open vials, one each for the DPT and the MR vaccine. What is the done next? So indirectly they're asking about your open vial policy, that two vials are open. One is the DPT, another is the MR. Now discard the both. We cannot discard the both. The use the both, we cannot use the MR because once it is open, dissolved to be used within 4 hours. Discard the DPT and use MR. This is also not there because we cannot use MR, but we are also not discarding DPT. We can use the DPT. So discard the MR and the use the DPT. This is your correct answer. And here they are talking about the open vial policy. And we all had discussed that the vaccines which are following the T group of the vaccines, like a TT vaccine, TD vaccine, DPT vaccine, and the pentavalent vaccines, that we can use within 28 days of opening of these vials, provided that their cold chain temperature is maintained. But those vaccines which are in the powdered form, so if we are dissolving them, then they should be used within 4 hours. So this is about the open vial policy. Now, which vaccine follow the open vial policy? The same concept they had asked in two different questions. The BCG, it is powdered form, is not following the open vial policy. Pentavalent, yes, it is following. The J, again powdered form, dissolved, not following. MMR, it is not following. So, pentavalent is following the open vial policy. Which vaccine has the seroconversion time less than the incubation period of that disease? Now, seroconversion means that there should be the good amount of antibody production. And a flu, it is having a short incubation period of around 18 hours to the 3 days, so not possible. Measles, yes, if you can remember, we had discussed the concept that if within 3 days of exposure we are giving the vaccine, it is producing the very good amount of antibodies by the 10th day, so we can avoid the infection. So incubation period is 10 to 14 days and the seroconversion time is only 5 to 7 days. So yes, the measles is having a seroconversion less than the incubation period. Rubella and the mumps, usually the incubation period is around 2 to 3 weeks, but it is taking a more time for antibodies to form. So here, the correct answer for this is measles infection or measles. Worker responsible for active malaria surveillance. As I said, repeatedly asked question, the active malaria surveillance, the worker is none other than multi-purpose worker. Now please listen carefully. Here if they didn't mention the male and female separately, then we have to go with multi-purpose worker. But if they had mentioned male and female, then we have to go with the male worker. Okay. So ASHA, it is not for malaria, but ASHA is for the active surveillance of what diseases? Active surveillance of leprosy, active surveillance of filariasis, active surveillance of leishmaniasis. It is the ASHA worker. And multi-purpose worker is for the malaria. Anganwadi workers are not involved in active surveillance. The health assistants are also not involved. So here the correct answer is multi-purpose worker. Then the lowest center where the patient can go. And if you just recall your healthcare system, so lowest center is in the village, that patient can go in the ICDS centers. Then after that, it is the sub center, then PSC, then community health center, district hospital, like that. So let us see what they are trying to tell us. The community health center or the district hospital, okay, PSC district hospital, okay, PSC and CSC medical college. So here the lowest center in this is the PSC. Some students were saying that this was the question like this, that where should be the first referral of the patient. Now we all know that till PSC it is the primary level care given by the village, sub-center and the primary health centers, and the patient is being referred for the first time in the community health center or the district hospital. If the question was as a first referral, in that case the answer should be the CSC or the district hospital. Clear? Because medical college is coming into the second referral, and PSC and district hospital, PSC, it is not a first referral. So two questions I can say that can be framed from this. that either the lowest center where the patient can go, then answer will be the PSC. And if they ask that what is the first referral center, in that case, it should be the CSC or district hospital. And that's why I said that with the exact language of the question, the answer changes. So don't mug up the questions, don't mug up the answer, try to understand the concept. Then another is the disease caused by the given mosquito. As I said that our insects are very important, and usually one or two questions are asked. And if you identify this image, the sitting location is they are sitting parallel to the surface with a hunchback neck, no spots on the body. So this is a Culex mosquito. Now, what is the disease caused by malaria? It is caused by Anopheles. So this is out. The Japanese encephalitis can be caused by this. The dengue is again caused by the Aedes. The Zika virus is again by the Aedes mosquito. So here the correct answer is Japanese encephalitis. Now, once the Zika virus word is there, and recently the cases of Zika virus is seen appearing, especially seen in the Uttar Pradesh, and this is a viral infection giving a symptom same like a dengue infection, but NS1 antigen is appearing as negative. Then incineration process is used for which color bag? Straightforward question. The incineration is used for a yellow color bag. Okay. Now, which is the principle of PSC? Now, we all know that principles of the PSC is equitable distribution. They are saying unequal distribution. So, which is the principle? So, unequal, it is out. Appropriate technology, yes, this is again a principle. Money, it is not a principle. And inter-country control, no. So the principles we had, the appropriate, the intersectoral coordination, appropriate technology, equitable distribution, and community participation. These are the four principles, and out of that only the correct here is the appropriate technology. Now here again there was a confusion in the question. Some students were saying they had asked that all are the principles of the PSC except, or some were saying they had asked which is the principle of the PSC. So it means we have to remember the principles of the PSC. The next is the most cost effective screening test for the cervical cancer. Now they are asking the most cost effective. The most cost effective is not a pap smear, because here we are requiring the expert cytologist. Biopsy, it is again not a cost effective, but Lugol's iodine, yes, by doing a Willi test in the periphery at the PSC, we can detect the suspicious patients. And colposcopy is again not a cost effective. So the cost effective is Lugol's iodine applied on the cervix, and we are having the colorless patch is suspicious in the Willi test, that is the Lugol's iodine we are applying, and this is a wire test where we are having the white patch as a suspicious. Okay, so this is done in the periphery, very cost effective, and suspicious are sent to the higher centers for either the pap smear or colposcopy guided biopsy. Now, if you want to know about the recent malaria transmission in the area, then the preferred indicator is, it means the malaria indicators are again important. The API, annual parasite incidence, it is giving us an about of malaria transmission, but not the recent. ARI, it is related to the tuberculosis, annual rate of an infection. Infant parasite rate, yes, it is giving us an idea about the recent malaria transmission. And annual blood examination rate is telling us a efficiency of the worker. So here the correct answer is infant parasite rate. The next is a pregnant lady had the rabid dog bite with minor scratch. So rabid dog bite with minor scratch, it means it is a grade 2 bite. So grade 2 bite में the line of action was the vaccine. Grade 1 में clean the wound and no vaccine, no, this was in the grade 1. Clean the wound with the vaccine, yes, this was the grade 2. We have to simply clean the wound and give the vaccine. Clean the wound with the vaccine and immunoglobulin, no, it is a grade 3. And no action needed, no, this is a scratch, it is action is needed. If it was a grade 1, then the no action was needed. A person reported to the ophthalmic OPD with vision of less than 3 by 6 in the right eye and the finger movement at 1 meter distance in the left eye. So here the better eye is the vision less than 3 by 6. Now many times the confusion happens that it is 3 by 6 or less than 3 by 6. Now less than 3 by 6 what we call as the blindness as per the new protocol. So it's a severe visual impairment, or it is the economic blindness, social blindness, manifest blindness. So I'll show you the chart again because this is a problem that we may have a confusion that if it is see the options, they are mainly asking about the uh, old classification and new classification mix. So we have to see that which level is sitting most suitable for this option. So categories were, they are asking about the less than 3 by 60. So 3 by 60 to 1 by 60, this is our category for which they are asking the question. And this is either the social blindness or it is the blindness. So now we have to go back to our options, because if it is less than 6 by 60 to 3 by 60, it is the economic blindness or the severe visual impairment. So that is out both. And so severe visual impairment was a less than 6 by 60 to 3 by 60. That is also same as the economic blindness. So this is out. Social blindness is yes, it is less than 3 by 60. And the manifest blindness was the less than 1 by 60. So here the correct answer for this is the social blindness. Okay. The next is a cardboard worker is at a risk of Bagasosis. Bagus is the sugarcane bagus, but here they had asked the indirectly the cardboard is also made of the sugarcane bagus. So this is at a risk of bagasosis because basinosis is related to cotton, asbestosis is related to asbestos, and the neuropharyngeal carcinoma is related to the wood dust. So here the students were able to answer this question by method of exclusion. So here again, I just want to give you the one success mantra that in the examination, if you are not able to directly catch the answer for that particular question, then you have to go by method of exclusion. And if you are very sure that other methods or other options are not true for that question, then the whatever the option is left is the correct answer. Because you know, basinosis is because of the cotton, the asbestosis is because of the asbestos, and the nasopharyngeal carcinoma because of the wood dust. So the cardboard worker could be at a risk of bagus or bagasosis. Then next is a man traveled to Assam, and after returning back, he developed the fever, giddiness, and on investigation confirmed to be a case of Plasmodium falciparum. So here they had straightforward tell us that a patient is coming from the northeast states and is having the falciparum infection, the treatment of choice. The patient is having the giddiness. Giddiness means some mental irritation. So patient may not be taking the medicine orally. So IV artemether could be a possibility, but let us see the other options. Doxycycline, no. Chloroquine, no for the falciparum. And artesunate sulfadoxine pyrimethamine, it is not for the Assam. So here the correct answer is that is IV artemether we have to give. So before answering, we have to read the other choices also. Remember this point. Now the food component help in the healing. Iron, it is not directly helping in the healing. Vitamin E, no. Vitamin C, yes. Vitamin A also help in the healing indirectly. Vitamin C, it is helping in the healing is better than the vitamin A. So here I'll go with the answer vitamin C, which helps in the healing. A patient from the Bihar presented with generalized bone pain and an excess of fluoride intake. Now see the image first. So this is appearing some brownish yellowish staining in the teeth. And the last option is a question in the line is the fluorosis of the bone is commonly associated with. So it means it is an image of the dental fluorosis and it is associated with the Osteopetrosis, no, this is associated with the osteosclerosis. So this is the correct answer for this question. The question is, a patient from the Bihar presented with the generalized bone pain and had an excess of the fluoride intake. So fluorosis is there, the dental fluorosis, and it is associated with the osteosclerosis. Now, what is a normal fluoride level should be in the drinking water? So wherever you are, please answer my frequent questions related to fluorosis. It is 0.5 to 0.8 ppm. Clear? Then when we can have the dental fluorosis? When the fluoride level is between 1.5 to 3. What is the maximum upper limit of fluoride? It is the 1.5 ppm. Which technique we are using to reduce the fluoride concentration? Nalgonda technique. What content we are adding is the lime, alum and the bleaching powder in the sequence. Clear? A patient with a fever was investigated and the peripheral blood smear shows the following features that identify the condition. Now this was again a confusing question because some says they had given an image of Vivex, some says they had given an image of falciparum. But here if I say that this is the image where a single ring is seen, and we may find the double chromatin rings also, and these chromatin rings are small and may be seen in the periphery. So this is going more in the favor of the plasmodium falciparum, but this is more of your pathology question. So you already had discussed different types of the malaria parasites there. A patient presented with a liver cancer who is working in a grain industry, the groundnuts, for the last 15 years. The toxin responsible for this condition. Now here, again, they didn't ask a straightforward question, but let us try to solve that. BOA, BOA, it is not related to the groundnut, it is related to the yellow pulse. So this is out. Aflatoxin could be related because they are saying that it is causing the liver cancer. We know that a toxin of aflatoxicosis, aflatoxin, it is causing the liver cancer, and where there is growth of fungus, and that is very commonly seen with the groundnut. So this could be the possibility. Parozolidine, that we had discussed that for pneumonic, that is AP or AP. Endemic ascites is because of the parolizidine, no liver cancer. Sanguinarine, we had discussed as the EDS and the BDS. So BDS or EDS, epidemic dropsy leading to sanguinary. So it is also not an option. So here the answer suitable is aflatoxin. Which level is taking care of the school health in the rural areas? And we know that under the school health, the medical officer is examining the school children, and medical officer is posted at PSC. So here the correct answer for this is, it is the primary health center, not the sub center, because medical officer is not at the sub center. Not the community health center, because they are the specialists there, not the sub district hospitals. Then another question. Now if you could see the image first, this is appearing like a ultrasound image, and this is your uterus with the outline, and this is the bladder anterior. Clear? And they had also shown that this is an IUCD query. This is an IUCD which is present in the bladder. Now see the question. Its removal by. It means they want to ask the removal of this IUCD, which is looking outside the uterus. So we know by hysteroscope we can remove any content which is inside the uterine cavity. So this is out. Laparoscope, yes, we can put a laparoscope and we can take it out, because with this one image, now please listen carefully, some might be having a question in your mind that it is inside the bladder, how we are taking out. So by one directional image only, we cannot say whether this is inside the uterus or this is just adjacent to the inside the bladder, or it is just adjacent to the bladder, or in between the bladder and the uterus. So we have to take a cross-sectional examination also, this scan also, we have to do an x-ray also. So we have been given only the single image, so best suitable answer for this, not the hysteroscope. Colposcope is again out because this is the scope of the only cervix, that we are examining the cervix. It is not going inside the cervix. Now by pulling the thread we cannot pull out because this is outside the uterus, so only we are left with the laparoscope. It means it is somewhere outside the uterine cavity, but inside the abdominal cavity, maybe adjacent to the bladder, so we are taking out through the laparoscope. Okay, so now we'll read a full question. A 30-year-old lady presented to the OPD with a complaint of the pain in the lower abdomen with a history of the copper T insertion 3 years back. On ultrasound examination, it was confirmed that a copper T is extrauterine near the ovary. As I said that it is not in the bladder, it is near the ovary, then obviously its removal will be by laparoscope. Clear? Now, which workers are more prone for fever as per the given observation? Now, this is again a graph I had made for the information I could select from the students. Now, these are the various qualitative data presentation. And if we see with these graphs, this graph number A is the pie chart and the graph number B is your bar chart. Now, if I say first the bar chart may, as the farmers are having the higher frequency than the factory workers or the housewives, then I'll go with the farmer as per the bar chart. But if I see the pie chart, again they are showing that 60% are the fever patients of farmers, then 20% are the factory workers, the 10% are the housewives, and the 10% are the white collars. So now we'll read the question what they are saying, that which workers are more prone for the fever as per the given observation. So we could see that here by the non quantitative or by the qualitative estimation, I could say that farmers are having the higher frequency. So not that housewives, farmers are yes having the higher frequency. Factory workers no, white collars no. So here actually they want to know from you the interpretation of the data, that by simply looking the observation, because in qualitative we don't require any calculations, simply by looking the observation we can give the report. Okay, so here the farmers are looking like having more prone for a fever. Vaucheria bankruftii cannot be seen in. Now, Vaucheria bankruftii is a worm causing filariasis, and we all know that this is very commonly seen in the blood as well as the lymphatics, but sometimes it can be seen in the urine also, it is seen in the ascitic fluid also, it is seen in the pleural effusion also, but it has never been seen in the saliva. So saliva is the best answer from the given choices, although this was a little bit difficult question because we never studied in such a detail, and we say that this worm is seen in the lymphatics going into the circulation. Clear? So here the saliva is the best option from the given choices. A child presented with history of diarrhea for last 12 hours. Okay, history of the diarrhea for a last 12 hours. Now he is severely dehydrated, okay, and unable to drink. And we all know if the child is severely dehydrated, not able to drink, we have to give the IV fluids. So ORS is out. Now IV ringer lactate, yes, we can give the IV ringer lactate, normal saline and dextrose. So it means they had given us a 3 IV fluids and we are never giving the dextrose saline, so this is out. We can give the normal saline, but ringer lactate is preferred over the normal saline, and the best is the diarrhea treatment solution, which they didn't give us. So the correct answer for given choices is the IV ringer lactate. So in this way we have to choose the correct answer. Now another is, to see the image, the baby is having a abdominal distension with some gray color hair, and the question they ask is the deficiency is. So obviously this is the deficiency where we are having the protein deficiency. On only energy, no, because energy is sufficient Only the protein, yes, only the protein deficient is there. That's why we are having the hypoalbuminemia and edema. Because if you had energy is also lost, protein is also lost, then we are having the marasmic baby. ये marasmic baby नहीं है, यहाँ पे swollen, सूजा फूला baby है. So here we are having only the deficiency of protein, not the energy. Most common cancer in the head and neck region in India, it is none other than the oral cancers. A 30-year-old person is coming from the China with suspected COVID symptoms. The test for confirmation. So for the COVID symptoms, we all know CB0, it is not used. The RT-PCR, yes. The HIV blood smear, no. ELISA, no. So here the correct answer was RT-PCR. Identify the virus. Although this might be a micro question, but we had also studied in a PSM, so we all know that it is showing the P24 antigen, the glycoproteins 41, glycoproteins 120, and this is none other than the HIV virus. So this is the HIV virus. Spike proteins are also there. Now the first step to be done for immunization survey. Now we know that for the immunization survey, which we are doing by the cluster random sampling, we should be knowing that how many children are vaccinated in the past 1 year and the left out we are vaccinating. Clear? So we should be knowing the list of the pregnant mothers. No, pregnant mothers list will not help. The vaccinated children in the last year, yes, it will help. The census data, it will also not offer help, and population of the area, not of the help. So this is the correct answer, the vaccinated children in the last year. See, I think more than 40 questions were asked in the last exam, and what we are seeing for the past 4 or 5 sessions, around 40 questions were asked from a PSM, and really it is carrying a great weightage. Doctors are doing the work and the extracurricular activity, the study design plan to know for the future requirement of the doctors which are doing the extracurricular activities. So here what they are trying to do, they are doing a study to see that how much of the work and the extracurricular activities the doctors are doing, and the study is designed to plan to know for the future requirement of the doctors which are doing an extracurricular activity. This is again, I not very sure this is the exact language of the question, maybe some different language, but this what I could frame. Okay. And obviously, this is not a cost benefit analysis, because in the benefit we are looking for the results. Sorry, we are comparing the money. It is again not there. Input and output money. Cost effective, again this is out because we are not having any results. Now network analysis is the graphical plan of all the events leading to the endpoint. So this is again not there. Systematic analysis or system analysis. But as per the question, I am also not happy with this system analysis. System analysis was actually, this is a little bit a mistake. System analysis was the comparison of the new technique with the existing one. But more I am going in favor of this as a work sampling, because in the work sampling we are trying to identify that how much of the time given for a work, and based on that we are deciding the numbers. So because they want to analyze that how much the doctors are doing the work and the extracurricular activities, and based on that they are demanding for the future requirement of the doctors. So could be a better option as the work sampling. Clear? So that's why I said that a question can be changed, the answer can be changed for that. But if a work sampling was not given, in that case, I'll go with the a system analysis as the answer for these given choices. Clear? A case control study was done to know the risk factors of the obesity. Now, two groups formed will be. So again, as I said, that they are asking about the two groups in the case control study to know the risk factors of the obesity. So here if you recall that in a case control study, one group will be of the disease individuals, another will be the control individuals. Clear? So here what they are asking to know the risk factors of the obesity. So here they are taking obesity as the one disease group, and these are the healthy individuals. And now they are asking the risk factor of obesity. Clear? So these are the two groups. One is of the obese individuals, another is the healthy individual. Now let us see the choices. Little bit difficult, not a straightforward, but yes, you can answer. The patient with and without the obesity. Yes, this could be an option. The patient with or without the obesity. The person with or without the online food. Now, online food is a risk factor of obesity because they are saying that they had an obesity in the individual. So there must be the one group of the obese individuals. So presence person with or without the online food, it is the risk factor, no. The person with or without the exercise, again this is the risk factor, no. The person with or without the smoking, again this is the risk factor. So I'll go with the first choice, that is the patient with and without the obesity, because these are the two groups what should be framed for conducting the case control study. The next is the demographic bonus. Demographic bonus means जैसे कोई benefit मिलता है ना, bonus मिलता है. So it is again not a straightforward question, but we will try to solve with the choices. Sorry. Yes. Population density. Population density has no relationship with the bonus. Now, reproduction in the population in the last few years, a reduction in the population in the last few years due to contraception. Yes, this could be there. As if we can recall, we had discussed the dependency ratio, that in the past few years our population rate is less, so we are having more of the working population. So this is the reduction in the population in the past few years due to the contraception is giving us a more of a working, hence, and we are having the lesser of the dependency. So this could be a demographic bonus. So this could be a probable answer. Fertility rate is not a demographic bonus. The literacy is not a demographic bonus. So I'll go with the option number 2. The reproductive health promoting agency is the UNDP is a United Nations Developmental Project. No. It is UNICEF for the children. No. UNESCO, it is for the heritage, cultural heritage. It is no. And UNFPA, yes, it is a United Nations Population Fund. Yes, this is related to the reproductive health. So unexpectedly, they had asked the 2-3 questions from international health agencies, which are not very commonly asked. So which agency gives the support to achieve the sustainable developmental goals? It is actually sustainable developmental goals are given by the United Nations, and they had a agency of the United Nations, that is a United Nations Developmental Project, which is giving the support to the developing countries to achieve their sustainable developmental goals. So here the answer is UNDP. Then agency which is funding the tuberculosis in India. Now we had discussed that SIDA is funding the tuberculosis, but here we don't find a SIDA. WHO it is not funding. Then USAID, that United States Agency for International Developments. Yes, this is also funding the countries to manage their local problems. The World Bank it is not funding. The Global Fund is not there. So here the correct answer should be from the given choices is USAID, United States Agency of the International Development. So these were the a few questions asked from the last exam, that is the June 2021, and I am all again wishing you that you should all come at the crossing line with the flying colors. So I think just take a break for 2-3 minutes, and we'll be discussing the another question paper of December 2020. So this will be giving you an idea that how the questions are asked in the examination, and whatever we are studying, that how we have to apply that knowledge. Okay, so just we'll take a break for 5 minutes, and we'll start with the next question paper. So here the time by my watch is, it is 4:49. So we'll start at 4:55. So, hello friends, welcome back. Now we'll be discussing the questions asked in December FMG 2020 examination, and we'll have a look on PSM questions. So, the first question was the contraindication of the device given in the image. Now, if I zoom the this image, so as you could see that this is some markings are there, and it is actually a copper T device because you could identify the thread is visible in the vagina. So they are asking about the contraindications of this device. Now we know that PID is a contraindication. So again, success mantra, once you find the correct answer on the option number A, still you have to read the other choices because sometimes in the end they could be the all of the above. Hypertension, no, this is not a contraindication. The lactation, it is again not a contraindication. The migraine, it is again not a contraindication. Then the best is the PID. The route of insertion of Assure implant. Although if you see the image and these are the titanium implants, you could just see on the corneal lens. And if you're not able to remember the name of these implants, they'd already given us the name that these are the Assure implants. But we know that if you have to put on the corneal lens, that it has to be passed through the hysteroscope. So it cannot be inserted through the laparoscope. It is passing through the hysteroscope, yes, not a vaginoscope because vagina till vagina we cannot go up to the cornus. Colposcopy, it is only of the cervix, so this is again out. So the correct answer is it is hysteroscope. A 19-year-old boy presented with a urethral discharge, which color kit will be used? And we all know that for the urethral discharge, we are using the gray color kit. The green, it is for vaginal, the yellow for the PID, and black, it is for the inguinal buboes. So here the correct answer is it is gray color kit. Okay. Identify the logo. So see, the first two questions were the contraception. So the contraception is again very important. And these two questions back to back were from the STDs. So identify the logo, as we had already discussed that this is the logo plus sign. But if you are having the dot in the center, then this is the logo of the Suraksha clinics. So this is not a logo of the first aid. I show you the few logos. This is the logo of your Suraksha clinics, and this is your logo of Indian Red Cross, and this is the logo of your first aid. Okay, so this is not a logo of your Red Cross, it is not your logo of the first aid, and this is your logo of the Suraksha clinics, not of an homeopathy. Okay, so here the correct answer is it is Suraksha clinics. Now, population coverage of the ASHA worker. As I said that suggested norm is 2000, but currently still we are having the 1000. So here the answer is 1000, not the 3000, not the 5000, not the 10,000. Okay, so correct answer is it is 1000. Post-marketing trial is after the completion of which phase of the drug trial? We know the post-marketing. They are not asking that what that phase is. They are saying after the completion of which phase. So after the completion of the phase 3, we are coming as a post marketing phase, that is phase 4. So phase 4 is post marketing after the phase 3, and phase 1 where we are doing on a healthy individuals to know the safety profile. The phase 2 we are just giving the drug to the patients to know the efficacy of the drug, and phase 3 we are comparing this new drug with existing drug, and once this is completed we are coming with the phase 4 trial. Okay, the next is the main worker of active malaria surveillance. See, it is asked in a December 2022 also, and this was asked in a June 2021 also. The main worker of the active malaria surveillance. Now here they had asked separately, not the ASHA, not the Anganwadi, male and female. So here the correct answer will be the multi-purpose worker male. While in the previous question we had seen that they didn't separate the male and the female, so our answer was a multi-purpose worker male. Okay. Then the next question is the demographic indicators, which includes mortality also. And we all know that demographic indicator which includes mortality is none other than the net reproduction rate. So here the correct answer to this question is NRR. A farmer reports to a clinic after the 8 hours of the unprotected intercourse. What will be the preferred method of contraception? This is, they are asking about the post-exposure prophylaxis, and we have discussed the best is the copper T, but it is not routinely used because it is disclosing the privacy. So preferred is 72 hours, within 72 hours is the LNG tablets. So LNG tablets, because they are asking within the 8 hours, so here the preferred will be the LNG tablet. Yes, OCPs we can use, but as the USP regime, but it is not preferred because of the high dose of the estrogen, toxic effects, the gastritis, vomiting is there. Mifepristone, again, it is not preferred. The IUCD, it is not preferred. So here the preferred answer is LNG 1.5. Now, which contraceptive is contraindicated in the breastfeeding? See, the contraceptive is again very, very important topic. The 3-4 questions are definitely asked. So, which contraceptive is contraindicated in the breastfeeding? Now, breastfeeding, we know that the estrogen containing contraceptives are contraindicated. The OCP is contraindicated because it is having the estrogen and progesterone. This is contraindicated. So this could be your right choice. If I say the Norplant is having the progesterone, it is contraindicated. The Minipil, it is again a progesterone, so it is not yet. So I'm sorry, marking wrong. The OCP, if I say that OCP is contraindicated, the Norplant is not contraindicated. Minipil, again progesterone, it is not contraindicated. The Depo-Provera is again progesterone, it is not contraindicated. So here the correct answer to this question is OCP. They are asking which is contraindicated. So that's why I say that we have to read the question very carefully, because we may make silly mistakes, as I am making some mistake in reading the questions. So you may be thinking wrong and you may come to the wrong answer. So in some questions, I'm intentionally reading in a wrong way. So this is giving you the real approach that what mistake you can do in the examination, because you may be reading in a different way, you may be thinking in a different way, you are answering in a different way, and your answer may be wrong. Okay, so be very careful and attentive in reading the this question. And one very important success mantra is that your brain should be relaxed, and you should be having a sound sleep of around 8 to 10 hours before the examination. That is very, very important, because if your sleep is not sound, not it's disturbed, you're not able to focus. So whatever you are reading, your brain is not able to understand, and you make the silly mistakes. Clear? So always take 8 to 10 hours sound sleep before the examination, and change your sleep pattern at least 10 days before the examination. Clear? Minimum thickness of the lead apron. The minimum thickness of the lead apron is 0.5 millimeter. Now see how carefully they had just changed the units, because अगर आपके दिमाग में 0.5 है, so you will go with a 0.5, then you have to see it's a millimeter or centimeter, and you may be confused. So it is 0.5 millimeter is the correct answer. Now, the time interval between the first possible diagnosis and the usual time of appearance of the disease. So, time interval between the first possible diagnosis and the usual time of appearance of the disease, B to D, is none other than the lead time. In a population of the 5,000, the reported birth rate is 25 per thousand. Calculate the number of the total pregnancies in that area. So, the total, little bit a numerical question. So total population is 5,000. The birth rate is 25 per thousand. So how many the total births in the 5,000 population? So total birth will be 25 into 1000 into 5,000. It means it is 125 will be the total births. Now if you can remember, we had discussed that they are asking about the total pregnancies, and the total births are actually excluding the wastage of the pregnancy. So if we have to calculate the total pregnancies, we have to add the 10% of this birth as a wastage. So our total pregnancies will be the total birth plus the 10% of this total birth as 125. So it is a 125 plus 12.5. That will be the actual, the total number of the pregnancies. So it is coming somewhere around a 137.5. So we don't have a half pregnancy, so we'll see the answer nearer to this is 128. Clear? So we had discussed, I think, the same numerical while discussing the total number of the pregnancy calculation in the prevention in pediatric and obstetric. So those who are not adding this 10% of the wastage, they can go with the 125. That is a wrong answer. And those who are subtracting this 10% of the wastage, because they know the concept of 10%, but they don't know whether it has to be added or it has to be subtracted, then they are going with the 112. And if they are going the concept that half is registered, then you're going with the 69. So see how beautifully the examiner is trying to trap you. So we have to add the 10% of the wastage. So the correct answer is 138. Clear? Now the Zika virus disease is transmitted by which insect? Straightforward question. Aedes mosquito, yes, it is transmitting the Zika virus. Anopheles, no. The Culex, no. Sandfly, no. So the correct answer is, it is the Aedes mosquito. Then Niti Aayog is the replacement of. We had already discussed that Niti Aayog is the National Institution for Transforming India, and it has replaced the Planning Commission. So it is the replacement of Planning Commission. While on increasing the disease prevalence, the which parameter is affected most? And I think we had discussed this question in our Telegram group also, that increasing the disease prevalence, if we are increasing the prevalence, the predictive value changes, because sensitivity and specificity is not affected by the prevalence. It is an individual test quality. So which parameter is affected? Not the sensitivity, not the specificity. Positive predictive value, yes, any type of the predictive value can be affected. The descriptive value, no. So this is affecting the positive predictive value. Clear? Again, a big question. So try to read the last 1 or 2 lines first, then we'll see that which test is used for analysis of these two groups after the 3 months of the therapy. So it means they are asking some test, chi-square, paired, unpaired, and ANOVA. So it means they are asking that which test we have to use, and we had already discussed that while solving these type of the questions, quickly we have to find out whether this is an qualitative data and quantitative data, one thing. Second thing is whether they are comparing the two groups or the more than two groups. And the third thing is whether they are comparing the paired or unpaired. So based on that, we can answer. So quickly we'll read the statement and we'll try to find out the these three answers. In a study, the patient were selected in the two groups. So, okay. So here the groups are two. This thing is out. That multiple groups are not there. They are the two groups. Of the 100 each of the different variety of hypertension, and their BP was measured. So now the second clue is their BP was measured. So this is your quantitative data. So now quickly think in the brain that for the two groups of the quantitative data, what test we are using? We are using the student T test. Now again in the two groups, we have to differentiate whether we have to use the student T test paired or unpaired. So now we have to see whether they are talking about the same group or the different group. Now BP was measured before and after the 3 months of the therapy. Okay. And which test is used for the analysis of these two groups after the 3 months of the therapy? So here it's a little bit twisted language to confuse you. They had given the two groups. Clear? And what they had done measured the blood pressure before and after the 3 months of the therapy. Means two separate groups are there, and for these two separate groups they had measured the before and after. Means at least they had 4 readings are there. For each group before, for each group after, like this they had a two groups. So now what they are doing, that a test is used for the analysis of these two groups after the 3 months of the therapy. So you can understand like this is a group A, this is a group B. So we had given the antihypertensive drug. So one group is BP measurement before the antihypertensive of group A, BP measurement of the group B before antihypertensive. Then we had given the drug for 3 months, and again we are recording the BP of this A group and the BP of these two group B group. Now what they are doing, they are using this comparison of the two groups after the 3 months of the therapy, means they are comparing these two groups after the therapy, though two different groups they are comparing, and then the answer should be unpaired t-test. So little bit a difficult language, but please read the question carefully, because they are saying that they are comparing the two groups, different two groups after the 3 months of the therapy. If I say till here, my question is the same, that in a study the selected in the two groups of the 100 each of the different varieties of the hypertension, and their BP was measured. And if I say that which test is used for the analysis of each group before and after the therapy. So if I am comparing the each group before and after therapy, then I'll be using the pair t-test. So see the language very carefully, it will change your answer. The next is a worker falls sick and getting the 3 months leave with a 70% of the salary. The type of leave is, we know that the sickness leave is given for 3 months with a 70% of the salary. So this could be a sickness benefit. Extended sickness benefit, no, this is given for 2 years with 80% of the salary. Maternity benefit for 6 months with 100%, and enhanced sickness benefit is 7 days or the 14 days for the tuberculosis or vasectomy with 100% of the salary. So here the correct answer is the sickness benefit. Rabies-free states of the Union Territory. Now rabies-free states of the Union Territory, Punjab is not a Union Territory, the Sikkim is not a Union Territory, the Andaman Nicobar Island is a Union Territory, and here the water is all around, so this is a rabies-free state also. And Punjab, it is not a rabies-free state. Sikkim is not a rabies-free state, and Jammu Kashmir also, it is not a rabies-free state. So they are asking that which state is free from the rabies, Union Territory or the state. So here the correct answer is Andaman and Nicobar Islands. Again, a big story. So first we'll read the last 2-3 lines. Ideal method of the disposal: red bag, white translucent black. It means they are talking something about the biomedical waste disposal. So quickly the reel should flash in your mind that which content are going in a white bag is a non-recyclable, which is going in a red, infectious recyclable, which is going in a white, it is the sharp, and the blue, it is the glass item. This what a reel is being running in your mind, and this should flash within few seconds. So now we'll read the question. A health worker is sitting in a vaccination clinic and throwing the waste in the container which contains the cotton, गॉस पीस, पैक्ड फूड, निडल, सिरिंज, सारी चीजें एक डब्बे में डाल रहा है. Now suddenly the medical officer comes on the round and pick the needle with a fixed syringe. An ideal method of disposal. Now here they are asking the needle with a fixed syringe. So here we are going more with the needle, that is a sharp item. Although the plastic syringe is fixed, no problem. It is going into the white bag. But please listen carefully. If they ask the needle is separate from the syringe and in which bag the syringe will go, then your answer should be the red category. Or in which the needle is going, then it is your white. But even a needle with a fixed syringe going into a white category or white translucent bag. Very, very commonly asked image. The condition seen in the deficiency of, this is the Kessel neck appearance, and this is none other than deficiency of the niacin seen in the paleograph. Microelements are all except. The selenium is a microelement. The copper is again a microelement. The zinc is also a microelement. Calcium is a mineral, but it is not micro. Micro means they are requiring in a very smaller amount, micrograms. But calcium is required in a milligram, so this is not your micro element. So the correct answer is the calcium. That is not your micro element. Now all are included under the SRS survey except. The SRS is a sample registration survey, and that is done every 6 month dual survey. Now IMR it is included because we had an IMR calculation by the SRS survey. MMR is also included. We get an MRR value. Death rate it is yes, it is also calculated. Birth rate is also calculated. So if I say that this question is again, it is not a correctly framed question because all can be calculated are included under the SRS survey. But still, if we have to choose a one that is not included, because birth rate is yes, definitely we are including, the death rate we are including, and IMR it is definitely there. So the least important figure is the MMR. So that can be your answer, but rightly said that this is not a properly framed question. In the central India, the most common species of malaria parasite. Now we know that falciparum, it is mainly in the northeast states, and the central India, mainly we are having the Plasmodium vivax as the most common species. Now image is given, you could see the elephant like foot are there, and this lady is might be doing the hot fermentation. So a lady with a swollen leg giving the history of off-and-on rigors fevers, but image is clearly showing the leishmaniasis. No. Filariasis, yes, because the swollen legs are there. Malaria, no, because in malaria also we had a fever, but not the swollen legs. Leishmaniasis also we had fever, but not the swollen legs. The fungal infection again, we don't had a fever and we don't had such of the swollen legs. So here the correct answer is it is filariasis. A child with the IQ of 55, mental retardation. We know that till 70 no mental retardation is there. Then we had the first is of the 20 group, then it is ranging from the 50 to 69, and that was a mild mental retardation, so this is coming in a 55. Then we had a group of 15, that is 35 to 49, 21 to 34, and 20 or less, that is the moderate, severe or profound mental retardation. Clear? So the correct answer is it is mild mental retardation. Now WHO package of the essential non-communicable diseases in the national program for control of cancer, diabetes, cardiovascular disease and stroke. Now we had recently discussed the program. So WHO package of the essential non-communicable diseases. So what are the non-communicable diseases? Means they are asking the full form of these four conditions. Hypertension and diabetes, yes it is there. Hypertension, diabetes, asthma, no, asthma is not included. Asthma, cancer and the diabetes mellitus, again asthma is not included. Now cancer, hypertension, stroke and diabetes mellitus, this is a better answer over the answer number A. So again your success mantra, if you think that this is your answer, hypertension and the diabetes, don't click, see the other options also, because here the best option is sitting at the option number D, that is cancer, hypertension, stroke and diabetes mellitus. And this is the logo we had recently seen. Now nurse has an accidental prick while collecting the blood of a known case of HIV, the preferred test for confirmation of the transmission. Now as we all know that the accidental pricking is possibility of the transmission is to 1 is to 300. Then if we want to know immediately, blood culture will not have any role. ELISA, it is in the window period, so again not helpful, but again ELISA, it is not for the confirmation. P24 antigen, yes, it can be, but not for the confirmation, because for the confirmation we are using the highly specific test, and highly specific test is your Western blot test. So here the correct answer to this question is Western blot test. Under the ICDS program, the intersectoral coordination is found with. Now, intersectoral coordination means it is coordinating with the other projects. Now, ICDS, it is in the village. ICDS centers are there, and they are coordinating with AIDS control program. No, they are coordinating with some of an MCH activities. So, NAREGA, that is not, it is for the giving the job, and National Rural Health Mission, yes, it is a part that they could be having the coordination with the activities of the NRHM. And tuberculosis elimination, no. So here the correct answer is National Rural Health Mission, which is ICDS is having the intersectoral coordination. Now, urban heart, as we discussed recently, it is a health equity assessment and response tool. So let us see the correct option. The urban health equity assessment and the response tool. Yes, this could be the possibility. Urban health evaluation assessment and the response tool. It is not an evaluation, it is an equity assessment. Urban health equity assessment and the response technique. No, it is a tool. And urban health evaluation assessment and the response technique, again not. So here the correct answer is option number A for this. Then another question was, oh, such a big question. Okay, no problem. We'll go with the last few lines if we are able to find out that on investigation, the medical officer confirmed that all students were sharing the food from the common canteen on a boarding school. Investigation of the choice to confirm the diagnosis is IgM for A, B, A and B for IgG. It's very difficult to comment with the options, so we have to read the whole question. A student presented with the complaints of an abdominal pain on examination. He was having fever and jaundice. Okay, so abdominal pain with the fever and jaundice, these are the keywords. Within a week, a few more students presented with the similar problems. Okay, on investigation, the medical officer confirmed that all the students were sharing the food from the common canteen in a boarding school. So they are giving us a hint that all the students had shared the common food. So we know that a foodborne is not the B. So these two are out. Okay. So foodborne hepatitis B transmission is hepatitis transmission seen for the hepatitis A only. So now the B is out. Now the question is that investigation of the choice to confirm the diagnosis, because we have to confirm the diagnosis whether this is a transmission with this food only. So we want to know the recent transmission, because sometimes we can have a past transmission and we can have an IgG antibodies also, but here they are talking about the recent. So we have to look for the recent transmission, and we know that a recent is by the IgM only. So here the correct answer for this is the IgM for hepatitis A. So in this way you have to integrate the concept of pathology also, the concept of micro also, and here the concept of PSM also, that is the how the epidemiology is there for hepatitis. It is transferring through the fecal route is the A, and through the sexual route is B. So here they are talking about the oral route, that through the food contamination. So this is hepatitis A, and they are talking about the recent transmission. So we have to look for the IgM antibodies. So these are the a few questions. Again, around 40 questions were asked from the PSM section. So in this way we had seen the previous year questions, and you might had get an idea that how these questions are framed And unfortunately, in both of the exams, the 50% of the questions were not a very straightforward questions. But yes, if we know the concept, we can apply our information and we can answer the question very well. So with these words, we are closing the session here and wishing you all the very best. And this doesn't mean that we are losing the contact. The repeatedly will be coming with the different sessions with you. Will be coming up with a revision also. We'll have our test and discussions also. And I'm always available to solve your queries, to answer your questions whenever you are in the doubt. Okay. So love you all, guys. Wishing you all the very best. Bye bye. Take care. So before that, if you had any doubt, any query, you can just message. So I'll wait for 2-3 minutes. If you had any doubt, any query, either you can message right now, or you, if you want, you can message me later on also. Uh, you are asking for the PSM notes PDF. I don't think you require a PSM notes PDF. You had already written. We had discussed each and everything in the class, and I think your handwritten notes are much better than the PDFs. Okay, because we are writing so many extra things. Now, question PDF. Okay, if you want, I can provide the question PDF. Okay, but I don't think again. There will be of a much help from these questions, because what happens that if I am giving you the PDF, you will be just reading the question and trying to mug up the answer, because once you read the question once or twice, you know what the answer is. But I want that you should be able to identify that what is the high yield topic and how the question is asked in the examination, and you should be able to analyze. Because suppose if a same question has been asked but examiner has changed the options, then your answer will change, and then you will say that madam ने आपने तो जब डिस्कस किया था उसका ये आंसर बताया था और अब इसका आंसर ये है. Because they had changed the situation, the answer will change. So I don't want to confuse you, so I will not be providing the question PDF what I thought, but still if you will force me, I'll provide. But from my side, that will not be of much help, and that's why I had personally discussed all these questions here, to just look right and left, up and down of the question, and to answer the question. Okay, so let me know as you want, but personally I feel that there is no need for giving the PDF of these questions. So with these words, we are closing the session here. Bye bye, good night, take care.